Hello everyone, good evening. The pandemic continues to ravage lives across India. As people all around us, our friends, our family, colleagues get infected, there are many questions all of us have. Questions on home isolation, how to treat yourself at home, whether steroids are needed, should you be stepping out at this point of time and get yourself vaccinated given the way the virus is spreading, and very importantly why the government of India is now saying that we need to wear masks at home as well. I'm putting all those questions to Dr. Randeep Guleria, one of India's leading pulmonologists and of course the director of the All India Institute of Medical Sciences, someone who is also a member of India's COVID task force. Dr. Guleria, thank you very much for taking time out to do this. We know you've been terribly busy through the day today. My first question to you is this. The government of India has recommended wearing masks at home today. Why is that?
So if you look at the way the virus is spreading, we know that it is a highly infectious virus. And what we've seen over the last few weeks is that from one family member, the whole family is getting infected, which was not happening in the past. Therefore, to prevent or decrease the number of cases, it's important that we have COVID appropriate behavior inside the house. And I would say not only wearing a mask, make sure that your windows are open, there is good cross ventilation, because we know that the virus tends to stay in the air for a longer period of time. There is aerosol transmission, and cross ventilation will also help. You could, when you're inside the house and you're not having guests or other people at home, you can wear a simple cloth mask also. But if you have people and you're sitting together with outsiders, it would be worthwhile either to have 2 layers of the cloth mask or to have a surgical mask over which you could wear a cloth mask.
Dr. Guleria, now about treatment. Who can be treated at home and who needs to be hospitalized? Any group that cannot home isolate, say cancer patients or people who are undergoing dialysis?
So those patients who have comorbidities, cancer patients or those who are on dialysis or those who have, let's say, very severe uncontrolled diabetes, they would need to be in hospital because of the comorbidities. But otherwise, almost 85% of people who are diagnosed to have COVID can stay at home and can home isolate themselves. However, having said that, there are 2 or 3 things that we need to keep in mind. First is that you have to really know how to home isolate yourself so that you are not infecting others and you know all the precautions. That these instructions are available in almost all websites, and the government of India also has it. It basically means that you confine yourself to a room with an attached toilet. You make sure that there is only one caregiver who provides you food, and that is given outside so that there is physical distancing maintained. You are wearing your mask and there is good cross ventilation, and there is no mixing of your utensils or clothes. So these guidelines should be maintained. The second important thing is that while you're at home isolation, you have to monitor yourself, because although we said 85% will be all right, 15% can deteriorate and may need hospital care. So you have to monitor your saturation. If your saturation is all right, then that should help. You should maintain your saturation over 94%.
Okay.
If you have fever, monitor your fever regularly. People will continue to have fever up to the 6th or 7th day. They should not worry. They should take the fever medicine sometime around the clock. And you may have acidity, gastritis, body aches, fatigue. Keep your hydration good, take good amount of fluids. If you find your saturation is coming less than 94, it's 93 or less, or your fever is becoming even higher and not getting controlled, it's going into 102, 103, or there's drowsiness, you're not able to respond, you're feeling too tired, sleepy, the caregiver feels that you are not responding, then you should immediately consult your doctor and you may need to be hospitalized. But majority of people will have fever which will go away on its own with some symptomatic treatment. They actually don't need a lot of drugs, including drugs like remdesivir. They just need supportive care and need not panic. Do some yoga, breathing exercise, take a good diet, and you'll be all right.
You've spoken about medicines. When you're home isolating or treating yourself at home, what are the medicines that you need to take? And you've spoken about it, but I want you to expand. Do I need to take steroids that can be inhaled? Do I need to take remdesivir? And if yes, when?
So first of all, let me explain this in a very simple manner, that if you look at treatment guidelines across the world, I'm talking of US, UK, Europe, in mild cases, it's predominantly symptomatic treatment. That means paracetamol for fever, keeping yourself hydrated. If you have a cold, you take your anti-allergic medicine, and if you have a cough, you take a cough syrup. The Indian guidelines have also added two drugs, which are the recent guidelines. One is that you can take a drug known as ivermectin for 3 days,
Okay.
or you could even take hydroxychloroquine, because of some data which suggests that these drugs may have a decrease your viral load, but it's something which is not essential and may be taken as per the guidelines. There is no indication for taking remdesivir or steroids in mild case. As a matter of fact, they may be harmful. The studies which were done on steroids in mild cases, the recovery trial, actually showed a higher mortality in mild cases who took steroids as compared to those who did not. And we've also seen that giving steroids early, even in other viral infection, including swine flu, H1N1, actually led to more severe disease. Therefore, I would really ask people to be cautious, not really rush on taking steroids unless it is really required. And it's usually required around the 5th to 7th day if you have features of falling oxygen saturation and other parameters. Also, don't go by your blood reports. Now, what has happened is people have started getting blood tests done very, very frequently, almost every day. And they then see their CRP, they see their ferritin, they see their LDH, and if it's going up, they start steroids. There is no data which suggests that this steroids are indicated. In all infections, even if it is non-COVID related, your inflammatory markers will go up. This is the body's response. You don't need to worry about it and you don't need to panic.
Okay.
Therefore, in mild cases, there is just supportive treatment that is required. You could take multivitamins. People take vitamin C, they take zinc, multivitamins. They have not been shown to have any benefit, but people argue that they are not harmful and therefore one can try them. But I would really say that for remdesivir and steroid, there is data which is against their use in mild cases rather than for their use in mild cases.
Okay. So speaking about oxygen, how do I monitor my oxygen at home? What is this 6-minute test that everyone is talking about?
So basically, there are two things that you need to do. One is you monitor your oxygen saturation, which is resting oxygen saturation, by using the oxygen probe which you put on your fingers, and it tells you your pulse. It also tells you your heart rate. So you monitor your oxygen saturation, which is at rest, when you are not exerting yourself and you're sitting quietly for 5 minutes and you're breathing normally. That gives you what we call your resting oxygen saturation, and we usually want it to be more than 94. If it's 93 or less, then we would say that you consult your doctors, then you need to be under close watch. On the other hand, we also can do a test which we routinely do in the hospital, which is known as a 6-minute walk distance. What we do here is we actually would ask you to walk briskly at your own pace, but as briskly as you can. You could even rest in the middle for 6 minutes. And after walking for 6 minutes, that is, you are exerting your cardiopulmonary system. You're exerting your heart and your lungs while you're walking. Then you again take your oxygen saturation and see has it changed. So if you have a little fall in your oxygen reserve, then your resting oxygen saturation may be all right, but there may be a significant dip of up to 3 or 4 points in the saturation on exertion, and that is something that can be brought to the notice of the doctor.
Okay.
So these are things that can be done at home in terms of monitoring, but I think you should just not panic. And if your oxygen saturation is 95, 96, don't really rush to the hospital.
Okay.
Don't start oxygen. Don't start steroids unless they're indicated, and don't start remdesivir.
Given the oxygen shortage, doctor, there are many videos floating around that seem to suggest that empty nebulizers can help up oxygen levels. Is that true?
Nebulizers are drug delivery systems. Nebulizer, inhalers, dry powder inhalers are all systems to deliver drugs. And you had asked me one question about steroid inhalers. So budesonide is one drug where there is some data which suggests that in patients who have a little bit more illness, it may be worthwhile to give the inhaler in the lungs, which may help to decrease the airway inflammation. So they are not oxygen delivery devices. They are devices, nebulizer devices, which deliver drugs into the lungs. Some of them may open up your lungs as what we call bronchodilators. They may dilate your airways, and that may help in easing your breathing. But that is basically in people who have asthma and have chronic bronchitis. There are not much use in healthy people, and therefore only for using a drug called budesonide can you take the inhaler or the nebulizer, because of some data which has emerged more recently that this may also help in decreasing the severity of COVID-19 if taken in the mild cases, mild to moderate cases, and that is where it can be used.
Okay. Doctor, after a home isolation period is over and you have recovered from COVID-19, you're showing no symptoms, is it advisable to do a RT-PCR test, or after 14 days, can you assume that you're all clear?
If you are healthy, you don't have any chronic disease, like we said, you're on hemodialysis or you're on chemotherapy, then if you are asymptomatic and you have been afebrile for 3 days and it's been more than 10 days since you were tested positive, then you are non-infectious.
Okay.
There is a lot of data which has now come up which suggests that after this, even if your RT-PCR is positive, you are shedding dead viruses and this is not an infectious period. So if your isolation period is over and you have been afebrile for 2 to 3 days, and it's been more than 10 days since your last since you've tested positive, you are non-infectious, you can go out, you don't need to get an RT-PCR test done.
All right, that was an important clarification, Dr. Guleria. Thank you very much. Given the strain that our testing labs are facing right now as far as RT-PCR testing is concerned, you're saying that once your isolation period is over, 10 days are done plus 3 days, no need to get an RT-PCR test. Now, if you have just recovered from a mild case of COVID-19, how long should you wait before getting inoculated/vaccinated? First jab as well as second jab.
So if one has had COVID-19, even after the first jab or is planning to have it and gets COVID-19, one would say that you should wait for about 6 weeks after you've recovered to take the vaccine, because that is the time that is needed for the immune system to recover and therefore develop a good response as far as the vaccine related antibodies are concerned.
Doctor, now to something that a lot of people are asking, because it is happening all around. Why is it that people are testing COVID positive almost immediately after getting vaccinated, either the first jab or the second jab? Now, we are hearing anecdotally about it a lot, though data doesn't seem to suggest, so far the government of India doesn't seem to suggest that this is happening on a large scale, but it is happening and people are talking about it.
So I think it's important that everyone who goes out to get the jab follows COVID appropriate behavior, because various vaccination sites become crowded areas, and that is why it's better to make sure that you have an appointment and you go when there's not much of a crowd. Because if you have a huge crowd of people wanting to get themselves vaccinated, many of them are not wearing the mask properly, then they can be a chance that you may get exposed out there, and before you develop sufficient antibodies, you may get the infection. Therefore, it's important for everyone to understand that just going for the vaccine doesn't mean you're protected. Getting the vaccine also doesn't mean you're protected. You need to have COVID appropriate behavior in terms of physical distancing, wearing your mask properly, and washing your hands.
Now, if someone has been exposed to a COVID positive person, should they be going for vaccination at all, irrespective of whether they are showing symptoms or not?
Yes, they can go for vaccination. It's not that they will get COVID, and there is no contraindication. If you're very much concerned, you could wait for 5 to 7 days to see whether you develop symptoms. So if you are what we call a close contact. Now, close contact is a person who has come in contact with a COVID positive patient for more than 15 minutes, distance is less than 2 meters, and you are not wearing a mask, the other person was also not wearing a mask. If that is the situation, very high chance that you would get COVID, and you should wait for 5 to 7 days, get yourself tested, and then go for the vaccine.
Okay.
But on the other hand, if that is not there, you can go ahead and take your vaccine.
Okay. Doctor, given the number of false negatives that we are seeing, should everyone go in for a CT scan?
So I think that there are two important issues. One is RT-PCR has a sensitivity around 80%. So you will have some people who may have classical features of COVID but may not be positive as far as RT-PCR is concerned. And this may look relatively big when we have a huge number of cases. That you will have people who are testing negative but have classical COVID symptom. If you have come in contact, or you are aware of having come in contact with the COVID positive patients, or in the time of this pandemic when there's a huge surge in your area, you have classical symptoms of fever, cough, body aches, throat pain, then you should assume that you're COVID positive.
Okay.
Even if your RT-PCR is negative or you're not able to get an RT-PCR or the result is awaited, isolate yourself. You could start the standard treatment that we were talking about and consider yourself positive. You may or may not get a CT scan because it's not that CT scan is also a gold standard for diagnosing. You may have classical symptoms and you may have COVID, but your CT may be normal. So the fact that the CT is normal doesn't rule out COVID because it may still be in the upper airways and may not be in the lungs. So
Okay.
CT is also not a 100% diagnostic tool to say that definitely you have COVID. So I
Okay.
think it's a combination of the lab report. If that is negative, then a clinico-radiological correlation with the current situation of the pandemic, which makes it highly probable that even if your RT-PCR is negative, but you have classical symptoms, that you have COVID-19.
Doctor, now I want to talk to you about children because there are children as young as 2, 3, even little babies who are testing positive. In fact, in Brazil, the worrying trend is that COVID-19 is killing little babies. I want to ask you, if kids are exposed to a COVID positive person, but are not showing symptoms, should they get tested? And even if they are showing symptoms, should they get tested? Because a lot of doctors are advising against it.
So with children, what we need to do is we need to make sure that when mothers are feeding them or when they are being breastfed or other feed is being given, they are wearing masks while they're doing this, washing their hands. The baby may not need to wear a mask, but at least the caregivers need to wear a mask and be sure that they are washing their hands with soap or a sanitizer every time they come in contact with the infant. The good thing is that infants usually have a mild disease, and if there is asymptomatic, we don't need to do anything. But if they are having symptoms, it may be worthwhile to also get them tested.
Okay, so symptoms will be what? Symptoms will be fever, uh, possibly some stomach-related problems as well, diarrhea as well. If a child, say a 3-year-old, is running a high fever, 101, 102, what do you do? What are the medicines that you recommend?
So the treatment strategy is almost the same. There are guidelines which have now come up. Our own institute has come up with guidelines and flow chart for the management of children and infants with with COVID-19 and what can be given, what should not be given, taking a risk-benefit analysis. But by and large, the drugs that we are recommending are the same. But most children also need just symptomatic treatment, paracetamol, syrup for fever, supportive treatment, and making sure that they are well hydrated. These type of treatment strategies are what is required. Most children usually have a mild illness.
Doctor, a quick word on desi nuskhas. Everything from kada to giloy to brahmi, everything has been tried by almost every Indian every citizen in this country to try and prevent them from getting COVID-19. Steam inhalation is something that a lot of doctors are doing as well. Does it help?
So there are a lot of things that are tried at home. One is steam inhalation. The other is various types of, let me say, local herbal medicines, which are tried by people, and even gargling is done. There is no data which suggests that any of them is helpful in terms of killing the virus, in terms of preventing you from getting COVID-19. But the argument has been that this is something that we as Indians have done for many, many years or centuries, I would say. And therefore, there is a feeling that it may help. And since it does no harm, it is something that can be tried. But I won't say that it's something which is going to really make a dramatic difference as far as your disease or getting the infection is concerned.
Doctor, one thing that every Indian wants to know right now, frankly, all of us are fatigued, we are fed up. How much worse will it get before it gets better?
So my own feeling is that it will get a little bit more worse before it gets better, but it's in our hands how we are able to bring down the cases, because it's very important that we start getting the cases down. Uh, it's causing a huge strain on the health infrastructure, both in terms of drugs, in terms of oxygen, in terms of hospital beds. And therefore, it's important that all of us work as a team to make sure that we don't allow this virus to spread. The most important thing to remember is this is a virus which spreads from one person to the other. It's a human to human spread. And therefore, if we are able to prevent it from spreading from one person to the other by avoiding crowds, by maintaining physical distancing, by wearing masks regularly outside and even inside, the virus will not be able to spread and the cases will come down. Therefore, if we do that, the peak will be, the cases will come down further, faster. Otherwise, it may take a longer time. And I think it will take maybe another 2, 3 weeks for it to come down from this part of the country. But the concern is that this pandemic is a moving pandemic. It moves from one area to the other as the cases tend to peak.
Correct.
It was more in Maharashtra that has started settling. Now we're seeing more cases in central India, and that will settle in some time. But we may then see a surge in the eastern part of our country, and we need to work aggressively to see that we are able to prevent that.
Doctor, I'm going to take a very quick break here. There's one very important question I still need to ask you. So I hope you can continue to be with us. A quick break. I'll be back asking that question to Dr. Guleria. Do stay with us. Welcome back. Dr. Randeep Guleria continues to be with us on Debrief, asking some of the most frequently asked questions. Doctor, one question coming in from a colleague in office. People with Alzheimer's or cancer or Parkinson's, people who are frail, are you advising that they get vaccinated as well, especially at a time like this when we are in the middle of the second wave?
So in an ideal situation, yes, they should get vaccinated because that is what is required. These are the high risk group and they can get a more severe illness if they get COVID-19. The only thing is that we have to make sure that they are protected while they go and get themselves vaccinated. So it would be worthwhile that they talk to the vaccination center and fix a time where the crowd is less. It could be early in the morning or late in the evening, and go and get themselves vaccinated so that the chance of exposure is minimized. But yes, they should get themselves vaccinated, but it should be done in a manner that we are protect the elderly or those who are frail so that we don't expose them to the infection while they come for vaccination.
And Doctor, my last question to you. I know this has been a very, very tough 1.5 years. We thought the pandemic had ended. Turned out it hadn't ended. It is ongoing, it is unending. I want to ask how doctors like you are holding out. How are you managing to cope, and how are you managing to make the very tough decisions that you have to make every hour and every day?
That's true. This is a very tough time for all healthcare workers. We've been at it for more than a year now, hoping that this will end soon, and have made a lot of personal sacrifices as far as this is concerned. But this is also a time when it is very, very challenging, at times very, very, I would say, heart-wrenching and depressing, because you're able to do only that much for your patients, and you have a large number of patients who are waiting to get a bed, wanting to get oxygen, wanting treatment. But you are at times struggling to balance everything out, triage everything, and try and see whom can you really help and whom can you not help. So I think this is a very, very challenging time for all doctors, and it really is something which has put a huge strain both physically and mentally. And that is why I would again appeal that we should all work as a team to bring the cases down, because that is the only way that we can really decrease the stress on doctors in the hospital. So I would just say that in the end, please follow COVID appropriate behavior. Don't form crowds. Accept your responsibility. Maybe local leaders, maybe the panchayat people, the colony leaders, the RWA, or society people, or religious leaders should come forward and really impress upon people to stay at home, not form crowds, and follow COVID appropriate behavior so that we can decrease the cases and thereby decrease the stress which is happening in the healthcare system.
Right now, it is our national duty to stay at home. That's the only way I can put it. Dr. Guleria, deep gratitude from our entire team for you and for your entire team for doing what you're doing. Thank you very much. Thank you very much for joining here on Debrief as well.